Hello there, and welcome to the Wonder Tooth Podcast with Dr. Saad. This will be our weekly episode. I hope you are keeping well and safe and that you are having your best year ever. This is Dr. Saad, the founder of Dent Blanche Dental, the best luxury dental spa in the US, and she will be your host. Dr. Saad will take you to the secrets and wonders of having an incredible smile, as well as healthy teeth and an overall health. She will give you some tips to make sure our podcast is rocking and rolling. Let's go, baby.
Hello, and welcome to our new episode of the Wonder Tooth Podcast. It's the holiday season. Everybody wants to have a nice white smile when we meet family and friends, and we have those nice gatherings, with the rest of the family. So I know that teeth whitening, it's a very big deal. For a lot of our patients specifically, and in general for, the public. We get a lot of patients who are not happy, not with the shape of their teeth, but with the color of their teeth. They want a little boost, and they try to put some darker lipstick, but then if it's not, into fashion, the newer, the more neutral lipstick now is in fashion, so it makes their teeth look a little bit yellower or darker. Now, let's talk about the teeth color to begin with. So not everybody has really white teeth. You're not born with white teeth. Some people, have a little lighter color other than others. But the general, really, it's the shade of the teeth can gradually increase or decrease on the grayer shade, which we as dentists look into it as the C shade, or into the yellower shade, which is the A shade, A1, A2, O3, or if it's more a little bit of yellow and gray, that goes under the D shade. So if you go to the dentist and you want to know, okay, what's, the shade of my color, first we have to look at the color of your teeth. Does it go under the A category or the D or the C? And there are also the B category, which is more like darker yellow. Some patients, they have two tones in their teeth, like a two-tone color. Like the top part could be more grayish, and then the bottom part of the tooth can be a little bit more yellowish. These are not the easiest one to actually whiten. And we're going to talk about different kinds of whitening, but I just want you all to go and look in the mirror and check the color of your teeth to see if it's like one monotone or if it's a two-tone, or some patients actually they have more than one tone in their, their teeth color. So we need to check on this. Then if you also have white spots, so some patients, they have a little bit of hypocalcification in the enamel, which is like white little spots, which means that the enamel is a little bit weaker in these areas. So sometimes it can be a little bit more difficult to whiten, but at least when you get some whitening, it might have the teeth color or the shade kind of blends in more, but the white spots cannot be totally eradicated with teeth whitening alone. There are other solutions, which I can actually talk about this in the next episode. If you guys are interested, just let me know in the comments. So what is better for me rather than you or somebody else? Everybody has different budget, different shade of their teeth, and different scenarios. For example, if you have fillings or composite fillings on your front teeth, they will never get whiter. Unfortunately, that's not gonna happen. If you have crowns, porcelain crowns, or porcelain veneers on a couple of teeth and not the rest of your teeth, they will not get whiter. They do not change color. Composite fillings, which is the white restorations, porcelain crowns or veneers, porcelain fused to metal crowns, so anything that is not natural will not change color. This is one thing. So I want you all to be aware of that. If you have white fillings on your front teeth, they will not change color. So even if you get the whitening done, those fillings will not change color. Of course, there is a solution for this, but I just want you to understand that part. If you have a couple of crowns on your front teeth, they will not change color as well. Now, if you also had a root canal done in one of your front teeth, these are very hard to change the color. There is, for example, a lot of patients like, okay, you were a kid, you fell on your front tooth, you got a root canal done, and now the tooth is changing color and it's becoming more like darker yellow, almost like a yellowish brownish color almost. These are very hard to whiten. Sometimes we can do internal bleaching, which I'm going to touch base on that, but it's not very successful. So there is two different kinds of bleaching now, or whitening. Don't use the bleach. Don't use the Clorox bleach. That doesn't work, guys. This is a killer. Do not use it. We're talking about whitening, which is bleaching the teeth. Has different concentrations, has different material that we're going to use. But first, there is internal bleaching and there is external bleaching. So internal bleaching, this is when you have a root canal done. So there is no nerve in the tooth, which means the tooth, the nerve is dead. And usually if it's in a front tooth, we usually, drill from the back, from the inside of the tooth. We make a little hole and where we go do the root canal. So if you have that little hole still, or even if it's covered with a white filling or a filling in general, we can remove that filling and put some nascent oxygen. It's some sort of whitening. This is called internal bleaching, which means it goes inside the tooth, not on the outside like the external bleaching. So we put some, whitening products inside in hoping that it will change the shade of the tooth from the outside, or it's going to make it a little bit lighter. Is it very successful? Sometimes it does, but sometimes it doesn't. So I just want everybody to be aware of that. And what would you do if the internal bleaching is not working because the external bleaching is not going to work either if you have a root canal treated tooth in the front? So the best option for that specific tooth, if the internal bleaching is not going to work, put a crown or put a veneer and try to match the rest of your teeth. However, let's say, okay, my teeth are a little bit yellower in general, but that front tooth is even darker, and I don't like the color of my teeth in general. So what would you do? First, get your whitening done. Get the external bleaching or the external whitening done first. Then try to match, go to the dentist, let them try to match the color of your front tooth to the rest of your already whitened teeth. This is the only way to kind of fix this if you really want to have some white teeth. Now, same thing goes if you have some filling or front filling, or if you have caps already existing there, that's going to be very hard to actually match. Because if the crowns or the veneers are, let's say, on one tooth or two teeth in the front, if they are the same color as your existing dentition, the rest of your teeth, this is going to be very hard, because then you're going to have to remove those veneers or those caps and have them redone to match the teeth that are whitened. So I always tell our patients, if you are planning to have, if you need a crown or a filling on your front tooth, the first question that would come out of my mouth, are you planning to whiten your teeth? They would say yes. And I say, when? Is it something soon, or you're going to wait like 5 years from now? Because, everybody, has their own agendas. So if they say, oh, I want to get it done like now, especially before the holidays, I would say, okay, we're going to need to whiten your teeth first. Then we're going to match the color of the filling or the crown or whatever to the already whitened teeth. Okay, did you get that, guy? This is very important. If you are going to get a filling on your front tooth or a couple of your front teeth, or if you're getting crowns on your front tooth or a couple of teeth in the front, or veneers in the two front teeth, not the rest of your mouth, not the whole mouth basically, or your smile design, you need to get some whitening done first if you are really planning of having, a white, bright smile. So this is very important. Okay, so now we spoke about the internal bleaching versus external bleaching. We understand that internal bleaching is for people who have a root canal already done in one of the front teeth and it's not getting whiter. Now, we're going to talk about different kinds of whitening. Of course, and this is very important, before you get any teeth whitening, you have to have your dentition, your oral hygiene already stable. What does that mean? Like if you have gum disease, don't go and tell the dentist, I want some whitening now. Okay, well, what about the gum disease, the foundation, guys? Please, we are here to help you, but we are also here to help you take care of your health first, then we'll take care of the cosmetics right after. We don't mind that, but please let us help you to keep, a good health, good oral health. This is really why we became dentists or why we became doctors in the first place. We have to help you achieve your health first to the optimum. Then we'll do whatever whitening you want, whatever veneers you want, but first the foundation has to be clean. Imagine you are building the biggest skyscraper in the world and you put all those beautiful like glass and oh my God, it's something very luxurious, but then there is water underneath. The whole thing is gonna collapse, and that's what I tell the patients. So please, if you need some gum treatment to be done, if you have broken teeth that needs to be removed, if you have very big cavities that needs to be fixed, and I'm talking in the back, not in the front, they have to be done before you get some whitening, please. Now, if you have a small filling in the front, because I don't want you to tell, okay, she's talking like, this is very controversial now. If you have a small filling in the front that can wait until you get your whitening done within the same week, then get the whitening done first, then get the filling fixed right after so that we can match the color, okay? If you have a broken tooth, like, oh my God, it's broken, I don't know what to do, it needs to be fixed right away, here's what I tell the patients. We are gonna put like a crown that's like a shade or two little lighter, a tiny little bit lighter, not much, because I don't know when you're gonna come back for the whitening. And then we're gonna do the whitening right after, and we're gonna stop where the matching, where the rest of your teeth are matching that crown, okay? And I wouldn't do that on the front tooth. I would do it maybe on the canines on the side, your eye teeth, or maybe a premolar on the side, not in the front tooth. So it's very important. So first, we talked about internal bleaching versus external bleaching. Second, we spoke about the different shades of the teeth in general, and if you have white spots versus you have a two-tone of the teeth color, or if it's just a monotone, and if you have the foundation is clean. Let's say, okay, everything is good, I have good oral hygiene, everything is beautiful, my teeth are clean. Now we can talk about whitening. Now, what are the main difference between over-the-counter and the professional whitening products? So over-the-counter, there is a lot of them. There are the toothpaste, of course, there are the whitening strips, and there are some whitening gel that you can do like a custom tray, like not even a custom tray, you can just put like a stock tray and put some gel in it. Then there are also the newer ones, which is you still have to get them through a professional provider, which is the one that you, I'm not going to say names of brands because I'm not really affiliated with anyone. But there are the ones that you have the little light it comes with a little light and you put it in your mouth and you just kind of do it on your own at home. Then there are the professional ones, the ones that are done in the office. And then there are the ones that are also kind of the boost of the professional ones, which is the one with the custom trays. And then we give you the gel. First of all, if you have very sensitive teeth, to begin with, teeth whitening might not be a very good option for you. Not all of them, but some of them. So you have to be very aware of that. Like, for example, if you drink hot tea, or if you walk outside in like a cold day and the cold air kind of hits your teeth and you feel, ouch, something is hurting me. Or if you eat an ice cream and something is hurting you. You need to get that checked first before you decide to go in the whitening mode. Because sometimes if you have some gum recession, that can become very painful if you do the over-the-counter whitening. And I'm not just saying that because I'm a dentist. No, it's because this is really true. If you have some gum recession and part of the root of your tooth root is exposed, the nerve endings are there. And if they are already irritated, any whitening products, whether the ones in the office, in the professional ones, or the one that you buy from the store, if things are not isolated properly, they can literally go on that root part and cause some excruciating, severe sensitivity there. So be aware of that, please. If you have some really sensitive teeth, I wouldn't get over-the-counter whitening products, period. Okay? Because how do they work? We're going to talk about this now. So some of the, especially the toothpaste, these are, they have mild abrasives in them, which means there are like, how do the whitening in the toothpaste work? They have basically like particles, and those particles starts to remove the outer layer, the stained layer of the enamel, little by little. Okay, well, now we have a nice fresh layer now, and teeth are white. But remember this: if you can, continue to do this over and over, that layer of the enamel is going to get a little bit thinner, which is going to start to show the layer underneath it, which is the dentin. And the dentin is mostly yellower. That's one. But two, the enamel is protecting the actual dentin because the dentin has the dentinal tubules in it, which basically very tiny little denticles of nerve endings are there. So if you overdo any whitening products, over-the-counter ones, you are basically putting yourself at risk of getting the enamel much thinner, and this is when you start to see through. A lot of patients, they come and say, I don't know what happened to my teeth, but I start to kind of see through them. They look like as if they are transparent. Yes, they are. And they are really transparent because the thicker layer of the enamel is getting much thinner now because you guys are kind of abusing them with those, the abrasives. So this is how I'm not saying all of them are the same, but that's mostly how toothpaste whitening products work. Now, there are also the whitening strips. So the whitening strip, they have a certain percentage of, peroxide. Once again, you have to be very careful if you have sensitive teeth or basically receding gums, and part of the roots are showing, or basically, when you put your nail, like just put it that way, if you put your nail and you're going to start to feel that there is a little step between the tooth and the gum, this is not okay. That means that you're over brushing, maybe you might be having some sleep apnea, you're over grinding your teeth, you might be having a clenching problem or grinding problem, or you're just scrubbing your teeth too hard. So now that little bit of layer that's protecting the area, it's gone. And if the liquid or the gel sits on that area, that can become very sensitive. So now we spoke about the toothpaste and how it works. And now we're going to talk about the gel, or the ones that are basically in stock trays. So stock tray means it's a little tray that can fit into anybody's mouth. And there is a gel that's sitting inside of it. I still wouldn't use it if you have some sensitive teeth to begin with. Some people, which sometimes we would recommend our patients to do this, to kind of combat, the sensitivity. Start using sensitive toothpaste. I'm not going to say names, but like really good sensitive toothpaste for like 2 weeks before using any, whitening products. And now we're getting into, the holidays and Christmas and New Year. So maybe you should start now. If you have sensitive teeth and you are planning to have some whitening done soon, get some sensitive toothpaste and try to use it for the first, for a couple of weeks. If you have trays to begin with, you had some sort of aligners done, or you have a retainer or something, sometimes you can put the toothpaste in it and let it sit on your teeth for like a minute or two before you rinse it off. It actually kind of help neutralize your the dentinal tubules a little bit, so it makes the teeth less sensitive. So this is one way of getting some whitening if you have some sensitive teeth. If you have a lot of sensitive teeth, I would just stay away from whitening, period. What's the difference now between the toothpaste? We know how it works. The whitening strips, so basically they have a little bit of gel, the peroxide, and it kind of helps doing external bleaching of your teeth. Then there are the stock trays, which are also over the counter, or you can buy them from some of the dental offices as well, which is a little tray that you put it in your mouth and it has the gel already in it. The only problem with all of these products is they do not cover the gums. Do you guys understand me? They can go and leach on the gums and then cause some sensitivity, but also sometimes they can cause the gum to be looking like if it's raw. And we have seen that. And it's not a pretty sight, and it can be very painful. Now, there are also those whitening products that you can buy from the dentist, or some of them you can buy, but I wouldn't recommend you guys buying something like from overseas. You don't know what's in it. If you're really gonna get something, try to go get it from, someone that you really trust, which is gonna be your dentist. And this is gonna be definitely cheaper, on a cheaper version, rather than, getting the professional whitening. But it's still better to get it from, a trusted source. That's what I'm trying to say. Like, don't go and get it from eBay or God knows what's in these products. And you might get some reaction to it. I had some patient had some allergic reaction to some of the material. We don't even know what's in it. And it's not good, because the whole mouth, basically, it becomes really raw. So please, please stay away from getting stuff that we don't know what's in the material, like what's the material that's really in it. Now, there are the ones that are the professional whitening. Why they are different than the other ones? So the professional whitening, if you look at some of the pictures that we post sometimes on our social media, it's very important to isolate the gums. And it's very important to isolate the area if you have some receding gums there too. Those little areas, we call them like erosion or abrasion, which is basically if you put your nail and you can feel a little step just above the gum line, just in that little area. So we have to isolate this, because this is where the nerve endings are. Then, basically how we do it, we have to isolate the lips first. And then we put a lot of isolating material around the lips from outside. We have to put some lip balm that's also has some SPF coverage. And then we cover the gums. We cover the area that's on top of the gums, which is the fold, we call it the vestibule, which is the fold going to the lips. We have to cover that as well, because we use some pretty strong UV light. Then we start to put the gel, the whitening gel, and usually they are like around 4 sessions. Each session is like 15 minutes. And we put that fresh layer of gel. And how does that gel works? So it produces nascent oxygen. It gets activated by the UV light, and it becomes nascent oxygen, which basically gets in the outer layer of the tooth going in. And this is how the tooth becomes more bleached. It becomes whiter. And this is permanent. And basically, you leave the office with white teeth. So there are usually 4 sessions. Each session is 15 minutes. So we put a fresh layer, and then after the 15 minutes, we remove that layer, and then we put another fresh layer. There are also different settings for how strong we want that light to be. Some patients, they want the teeth to be like maybe not too white, especially if they're a little bit, on the older age group. They want, like maybe a couple of shades lighter. So we have less intensity. So we have more control over the light that's actually gonna activate the nascent oxygen. But some patients, especially the younger generation, they want like really white teeth. So we can go sometimes 5 or 6 shades lighter. So imagine if you are looking in the mirror right now and you're looking at your teeth and be like, oh, my teeth are more on the grayish scale. Let me see how that's gonna go. It can go literally to a bleaching shade. Bleaching, like white bleaching shade. And we're not talking about just the 2 front teeth. We're talking about all the top and bottom teeth. And how does it work? It works by the activation of the UV light. Now, the different concentration also in the material, like in the gel that's used in the office, is like 22%. 22% the concentration. The one that you get at the dentist office, like that's a stock tray, it's sometimes like between 14 to 15%. So there is a big difference there. And there is also the boost that you can get after you get the professional whitening, which is we get you some custom trays. And that's usually maybe not right away, maybe after 8 or 9 months. Sometimes, with, like coffee and tea and wine, the teeth can basically lose, their brightness. So you can get those custom trays, and then we give you the professional take-home whitening gel. And then we teach you how to do it. It's very simple, and it just kind of boosts, because your teeth, they already they were white. We just kind of boost that whitening again into the teeth. That needs an oxygen. So yeah, that's really it. But I would recommend, if you have, as I said, some sensitivity to begin with, you really need to look into using some sensitive toothpaste. And if you have, fillings on your front teeth, you have to also look into that. Now, why is the whitening that's done in the dental office is far more superior? Because there are few things. It's not just about the concentration, but also the fact that we can control the amount of light, that's the intensity of the light that's going in. Then we also can control the isolation of those certain areas. And the fact that you leave, I had a patient actually last week, he's getting married next week. So this is a big thing, Of course, everybody wants to have a beautiful smile when you're getting married, or if you have a big event, or, a big party coming up. So the superiority of the professional whitening is you leave with white teeth on a spot right away. The other ones, it takes time. Sometimes it takes 3 weeks, sometimes it takes 6 weeks, and you're just buying the material. So if you really add up, it kind of get close to if you're getting professionally done anyway. That's it really for today. As I said, it's just kind of like a conclusion. There are different whitening products. The toothpaste, which we understand, it's they have abrasives inside of them. And there are the strips, which is, a little layer of peroxide. I wouldn't recommend you guys also trying to swish around with the hydrogen peroxide straight. It's good for infection. It's good if you kind of dilute it with a little bit of water before rinsing with it, but because this is also you don't want to swallow that's for sure. Then there are the over-the-counter, stock trays with some gel into them. As I said, the concentration is much lower than the one that's professionally done at the dental office, so it can take you a lot longer to reach the desired results. And then there is the in-office whitening, which is we spoke about this, and we spoke why it's more superior than the others, because the concentration, but because also the time and the fact that we can tailor it to be customly fitting your needs. As I said, if you have one crown that's on the front and it's a little lighter, we can match the color. If you do whitening over the counter, it doesn't work that way. And lastly, there are the take-home kits, which is we make you a custom tray that you can actually keep forever, as long as your teeth are not shifting, and you can just buy the gel from the dental professional and you're good to go. With that being said, I wish you all a happy holiday season, and don't forget to brush and floss and take care of your teeth so that they can take care of you. Okay? And have a wonderful holiday season, everybody.
Thank you very much for taking the time to listen to our weekly podcast. This show wouldn't really be possible without you. If you are a fan of the show, please leave us a comment on Instagram at rodwasad_DMD. The link is in the show notes. Until our next episode, remember, if you take care of your teeth will take care of you. Keep smiling with Dr. Saad.